Hello there, welcome back to my channel. It's your everyday Miss Abby. We are still continuing our series on depression, and let's not forget that depression is a mental condition. So, in our previous discussion, we talked about what depression is, we learned about the difference between sadness and depression, we learned about the clear characteristics or signs and symptoms of depression. We also got to know about the causes of depression and its treatment. Today, we are going to talk about overcoming depression and preventing relapse. Please kindly visit my previous video for more content on depression. And don't forget to subscribe to my channel, like, and also share. Let's get into our video for today. So, in overcoming depression and preventing relapse, the first thing you have to consider, or the first thing you have to do, is going back to lessons learned during treatment process. Yes, it is very, very vital to our treatment or to overcoming depression. We know that when we are going through treatment for depression, there are therapies and counseling sections that we go through. It is important that you jot vital information during those sections or during those therapies, because whilst you are going through treatment or whilst you are still managing yourself having depression, there will be times where you would forget things that you were taught, or you would have some setbacks, and it is important to go back to these notes that you wrote down to relearn those things that you were taught, so that it will help refresh your mind, so that every time that you are going through crisis or every time that you are feeling depressed, you can revisit those notes to help you better overcome your condition. So that is the first thing you have to consider, going back to lessons learned during treatment process. The next thing to talk about is identifying triggers to your condition. So there are many triggers that brings about worsening times of depression. There are times where there are triggers to your condition, which will make your depression worse. So it is important that you identify triggers to your condition. Is it substance abuse? Is it stressful event? Is it anxiety? Is it low self esteem? What is your trigger? You have to identify that trigger and find effective ways of managing them. Or when you are feeling stressed, you take time to rest. Or when you feel like you are being anxious about something, you just um change your approach, or you stop for a while, or you relax for a while, so that you do it later when you are feeling better. If it is substance abuse, maybe alcohol, marijuana, cocaine, or any substance, you try to stop taking those substances so that it doesn't make your condition worse. So it is important to identify your triggers and then find effective ways to work around them. The next thing to talk about is maintaining activities of interest. We know that when we're having depression, or when we are going through depression, you lose interest in previously enjoyed activities, and even to the point of not doing certain daily activities. So it is important to make a conscious effort to stick to those interests. If you are the gaming type, if you like watching television or movies, if you like reading, if you love music, if you love spending time with the family, ensure that you consciously maintain those interests, because if you don't, it would put you in that depressive mood and it will make your condition worse. So even when you feel awful and you don't feel like doing anything, it is important to make that conscious effort to do something that is of interest, because it would help better your condition and help overcome depression. So it is important to do those things. The next thing to consider is maintaining a strong supportive relationship. That is keeping that strong relationship with family, friends, loved ones, and others. When you're having depression, you don't have the feeling to spend time with others. Sometimes you want to withdraw yourself or isolate yourself from people and just wallow in your pain and then have those negative thoughts and all that. When you are alone, that is when those negative thoughts and those bad feelings come to you. So it is important that you consciously spend time with your family, spend time with your loved ones, spend time talking to them. Don't be alone in your room, because the more you stay indoors, the more you have those negative thoughts. So try going out with friends. Try spending time with the family, with your wife, with your children. If you're not married, if you're in a relationship, spend it with your partner, spend it with your friend. Have fun and then enjoy yourself, because it will better help your condition and it will help you overcome depression and also prevent relapse. The next thing to also consider is seeking for help when feeling overwhelmed. There are times when you feel like you've tried your best, but things are not becoming better. You realize that you are doing things that you're supposed to do to better your condition, but you are thinking, when is it going to end, or when is this going to last? That time you have to ask for help, you have to seek for help, you have to speak to a friend or speak to your psychologist, speak to your psychiatrist, find someone to talk to about your problem, because a problem shared is half solved. So try to share your problems with other people so that they can help you, give you an advice, so that you can look on the positive side of your situation or of your depression, and it would help you overcome depression. The next thing to also consider is contacting your psychologist or your doctor or your psychiatrist when having the feeling of relapse. There are times where you can feel that your condition is becoming worse. Maybe it was okay, it was better, but then it gets to a point when you realize that things are becoming very bad and you are becoming more depressed. Speak to your psychologist, speak to your psychiatrist, speak to your doctor about what you are going through, so that your treatment can be modified so that you can be able to cope very well with what you're going through. It could be increasing the dose of your medication, or starting a therapy section, or doing something just to help your condition. It will help you overcome depression and also prevent relapse. The next thing to talk about is maintaining an effective medication regime and also going for review on review dates. Most of the times when people are going through depression and they feel that the condition is becoming better, or maybe because of the side effects of the medication, they stop taking the medication and they stop going for review, thinking that they are okay and everything is fine. You can't really determine if you are feeling okay or you are not feeling okay. Fine, things may be normal, you are going about your daily activities, you are doing vital things that you are supposed to do, but you don't know what will happen. You should only go off your medication when your prescriber or your doctor says so. Or you are supposed to stop doing something when your doctor says you should stop doing that. But it is very important, if you do not want to relapse and you want to overcome depression, that you stay effective to your medication regime, and you also go for your reviews on review dates. You don't stay home and say, okay, fine, the review is today, but I will go another time. It doesn't really help your condition. So it is better to take note of that. The last thing we'll be talking about is focusing more on cognitive behavioral therapy. Why is this so important? This particular therapy works on our behavior and our moods or our feelings. So it helps us to replace negative thoughts and behavior with positive ones. So this is a therapy that when you go through, it will help modify positive behaviors and then thoughts. So it will help you find effective ways to do away with negative thoughts, negative feelings that will lead you to becoming more depressed or even committing suicide. So it's very very important to have more knowledge about that and how you can use it effectively in managing your condition. So these are a few points we will be touching on today, or as in we'll be considering today. So please, one thing you should note is to read more about your condition. Like I continue saying, knowledge is power. When you know what you are faced with, you will be able to overcome it. So read more about your condition, read more about depression as a mental condition. And I believe that with more effort, you will be able to overcome it effectively. Thank you very much for your attention. It's your everydayness, Abby. Don't forget to subscribe to my channel, like, and also share. See you in the next series.